Well, thank you, and it is an honor to be here at ALEC Policy Summit with so many state legislators. The first thing I want to say is thank you. Thank you for your service to your country and to the citizens of your state. I don't think I need to remind most of you how hard it can be to get things done in this town. The federal government just isn't as nimble and responsive as state governments. State leaders are closer to the people and the problems they face each day, which gives you the knowledge and the motivation necessary to take action and make the tough policy decisions that are needed. And that's why it's so important for states to retain a strong lead role in taking on the toughest problems facing this country. And that is especially true for healthcare. I've spent my entire career working to make sure that people have better access to healthcare, including working on the front lines at a public hospital and working with states to design innovative programs to address the problem of the uninsured. And before I came to CMS, I worked with states as they wrestled to implement the Affordable Care Act. And seeing the problems the ACA created and seeing the lack of federal action to address these problems should be proof enough for why it was such a mistake to federalize so much of healthcare policy under the ACA. So I come to this job with the belief that Washington doesn't have all the answers when it comes to our healthcare needs, that states are the laboratories of innovation and reform, and that healthcare decisions centralized in Washington too often come at the expense of patients. And while the Affordable Care Act expanded coverage, it has not addressed healthcare spending. After the law was enacted in 2010, research shows that there has been no change in the rate of growth. The reality is that the rate of growth in healthcare spending has been a crushing financial blow for too many families, and especially the millions of Americans who are unsubsidized and have had to face rising premiums, fewer insurance choices, and in some cases, an inadequate network of medical providers. And no one can say that this is due to the Trump administration. This chaotic and declining market is what the administration inherited in 2017. And let's examine the facts. We were told annual premiums would drop $2,500 per family, and yet average premium rates for plans in states using healthcare.gov rose by 105% from 2013 to 2017, the final year of the Obama administration. 105%. And what other product or service in the economy more than doubled in price over those 4 years? Nothing on my shopping list. Some states had it even worse, such as Alabama, where premiums increased by a jaw-dropping 223% over that time. And so at today's prices, it's no surprise that unsubsidized people are now leaving, actually fleeing the market. There was a 20% drop in unsubsidized enrollment nationally between 2016 and 2017. That's 1.3 million people walking away in just 1 year. And some state markets are faring far worse, with a 40% drop in 6 states, and Arizona losing over 70% of its customer base. And 2018 enrollment data suggests that this downward spiral amongst the unsubsidized may actually be accelerating. It is no hyperbole to say that this unsubsidized portion of the market is now in a debt spiral in many states. And one reason prices are so high is due to the decline in choice and competition in the market. Today, in over half of the counties in America, consumers have access to one insurance issuer. That's just one, which is really not a choice. With no competition, these monopoly insurers have the market power to hike up rates. And for anyone who understands how competition delivers better value to consumers, it should come as no surprise that a recent study found that exchange premiums were 50% higher on average in rating areas with a monopoly insurer compared to those with more than two insurers. The ACA attempted to insure every American and even tax those who refused to pay for it. But because nothing was done to control cost, the insurance problem has not been solved. For many Americans, it's actually been made worse. Facing these rising prices and dwindling choices, no one should have been surprised when the president charted a different course. On day one, President Trump issued an executive order directing agencies to minimize burdens caused by Obamacare and provide greater flexibility to states and cooperate with them in implementing healthcare programs. And within 3 weeks, CMS issued a proposed market stabilization rule. This rule delivered on a number of policies industry analysts had advised to strengthen the market. And building on the market stabilization rule, CMS issued a 2019 payment notice rule to give states additional tools to stabilize their health insurance markets. And President Trump also signed legislation zeroing out the individual mandate tax penalty. This was a perverse tax that charged people for not buying something that they couldn't afford. And worse, the tax fell to lower income people. Nearly 80% of the households paying the tax earned less than $50,000 a year annually. This administration has also opened up more affordable coverage options by expanding association health plans and short-term plans, which can provide a lifeline to certain people that are priced out of the individual market. And while these plans are not for everyone, we have made certain that consumers are informed about the limitations of these plans. And analysis show that these steps will open up dramatically more affordable coverage options for certain people and expand the number of people with coverage, and with only minimal impacts on the rest of the insurance markets. And we believe there's room to provide these new options while still working to strengthen the individual market. And one strategy that we're hoping can further strengthen the individual market is to allow employers to fund individual market premiums. In October, the administration proposed an exciting new policy that would allow employers to fund individual market premiums through their employees through health reimbursement arrangements, or HRAs. The HRA proposal would give employees an incredible amount of control over their health care, while at the same time keeping the employer involved as a strong partner in maintaining coverage. Under our watch, we have also enhanced the capabilities and operations of the exchange, providing more consumer assistance tools and implementing a new streamlined direct enrollment process for consumers signing up for exchange coverage through private agents and brokers. The results? The exchange call center hit an all-time high customer satisfaction rate, averaging 90% through open enrollment last year. So we've been incredibly busy working to promote more affordable coverage options, and let's examine the results. Because of these actions, premiums are stabilizing. Average premium rates for a benchmark plan on healthcare.gov will decline by 2% in 2019, the very first decline in the ACA's 5 years. And yes, some people might say that 2% isn't much of a drop, but it is a large departure from the double-digit increases of recent years. And there are a number of states with larger declines, including a 26% drop in Tennessee and a 16% drop in Pennsylvania. Another good sign is that insurers are expanding into new markets, and there are 23 more issuers for 2019 than 2018, and only 5 states will have 1 issuer compared to 10 states in 2018. With increased stability, it is no surprise that despite dire predictions, the uninsured rate also remains steady in 2018, as a new report from the CDC shows. So I'm having a real hard time understanding all of the criticism leveled at this administration. Critics see subterfuge. The reality? We've delivered stabilization. And I am so proud of how the dedicated team at CMS has been able to deliver a set of policies that balance the need for market stability with the need for immediate relief from rising premiums. But let's be clear. While the ACA's vital signs have stabilized, the patient remains in critical condition. Stabilizing already high rates means you still have high rates, and millions of Americans are still priced out of the insurance marketplace. And for those of you that know me, you know that I've spent years as a consultant to states, and it was my job to find innovative solutions, to be a problem solver. And based on that experience, I know that there are opportunities for states, but I also know that Washington is too often an obstacle to innovation. Washington is where innovative policies go to die on the altar of bureaucratic worship. And now that I've moved from Indiana to Washington, I'm working to change that. The federal government should be working in closer partnership with states to foster and support innovation. And in fact, President Trump's first executive order directed federal agencies to provide greater flexibility to states and cooperate with them in implementing healthcare programs. So last month, we took a major step towards empowering states to address the problems caused by the ACA by giving states broader flexibility to waive certain ACA requirements and create real alternatives. Under the law, a state can waive these requirements so long as the new state healthcare program meets a series of 4 guardrails. Specifically, a waiver must provide coverage that is at least as comprehensive and affordable to a comparable number of people as without the waiver. In addition, a waiver must not increase the federal deficit. Unfortunately, guidance issued under the prior administration in December of 2015 significantly thwarted the types of creativity and innovation that states could pursue. With this unnecessarily restrictive guidance in place, very few states have come forward with innovative new strategies for improving their healthcare markets. In fact, we've only approved 8 waivers, and 7 of them are the exact same type of waiver. And before I came to CMS, I worked with states on 1332 waivers and found it was impossible to put forward creative ideas. And under these severe limitations, the states that I worked with essentially gave up. So compared to the prior guidance, this new guidance empowers states to provide relief through a number of new tools. And most importantly, the guidance increases flexibility with respect to the guardrails. The guidance also provides new functionality for states to leverage the federal exchange platform and work with private industry. Now, after we issued this guidance in October, we received some criticism, pretty shocking, that the guidance opened up opportunities to reduce federal protections for people with pre-existing conditions. To be very clear, the ACA's pre-existing condition protections cannot be waived. In addition, the President, Secretary Azar, and I have made clear that we will protect people with pre-existing conditions. Critics of state flexibility will always assume the worst. Indeed, cynics will always be able to imagine negative ways states might screw up if given some flexibility. But if a state does get something wrong, unlike the federal government, states have the flexibility and the incentive to fix it. And this is because it's much easier for citizens to go to their state legislator's office or the governor's office than to have to come to DC. And it's amazing how little faith Washington has in each of you to do what's best for the citizens who elect you. In addition to this new guidance, I am pleased to announce that today, CMS is releasing 4 waiver concepts to help illustrate how states can take advantage of this new flexibility. Through the new guidance, it substantially expands state flexibility, and I know that states would benefit from further details and examples of how to use the flexibility. For one example, maybe with the best potential to address various structural problems with the ACA, I went back to something that I tried in Indiana. And under this approach, a state could provide a contribution to an account that people would manage and could be used to pay both premiums and any other types of out-of-pocket healthcare expenses. This approach would empower individuals to pick the plan that works best for them and their families. It would maximize consumer choice and engagement, giving people stronger incentives to make smarter decisions with their healthcare dollars, and increase the demand for price transparency because they directly retain the benefit of any unspent dollars from the account. An account also creates the best opportunity to create true portability and continuity across the exchange, Medicaid, and employer-sponsored coverage. And to the extent that the account is compatible with other financing sources, a person could seamlessly transition from one to another as income and eligibility for programs change. Furthermore, the defined contribution to the account can help control premium growth and, as a result, limit the growth in public subsidies by establishing a clear individual healthcare budget right up front. And compared to the present subsidy that's set to match premium growth each year, a defined contribution can help establish a personal budget up front and drive insurers to set coverage and premium levels to meet that budget, which creates at least some pressure to contain premium growth. Consumer engagement, personal freedom and choice, spending smarter, price transparency, portability, and controls over premium growth. What's not to like? Earlier in my career, I had the honor of working with then Indiana Governor Mitch Daniels to create the nation's first consumer-directed Medicaid program. And what we found, I think Senator Buck can attest to this, that Hoosiers, no matter what their socioeconomic status was, wanted control of their health care. And when given the opportunity to control their own health care accounts, they used the system more appropriately, such as fewer trips to the ER, and had better health outcomes than those that merely received a government-controlled handout. The account-based approach might hold the promise. However, we've released 3 additional waiver concepts that can work in conjunction with these accounts or separately. States can develop a new state premium subsidy structure and decide how premium subsidies should be targeted. States can set the rules for what type of health plan is eligible for state premium subsidies to give people access to more health plan options. And states can implement various risk stabilization strategies to address the costs of high-risk individuals to reduce premiums in the market for everyone. These waiver concepts that we're releasing today are offered as a springboard to spur innovation and thinking among states on how to develop better healthcare programs across the country. Ever since President Trump took office, critics have accused the administration of intentionally sabotaging the ACA. And what they conveniently ignore is that the hard facts show that the individual health insurance market was in serious trouble when President Trump took office. People needed more affordable health coverage options, and everything this administration has done has focused on delivering more affordable options. And there is much more work to do. And coming from Indiana to DC, I know that it cannot be done without partnering with states. As state legislators, I hope it is now clear to you that the Trump administration is here to support your efforts to develop local solutions to provide your citizens with higher quality, more affordable healthcare coverage. And that's why we've released new guidance on waiving ACA requirements and today, the waiver concepts, illustrating how states can make use of this flexibility. I believe in states and their ability to make innovative decisions to improve the health of their residents. Because what's working or what could work in Michigan may not work in Montana. And for far too long, states have looked to Washington with the mother may I approach. Washington has placed unworkable restrictions on the states, in the process undermining the very goal of its own policy, which was to make insurance more accessible by making it more affordable. And today, we are saying the states have the power to make the individual markets work through innovative policies that best meet the needs of your citizens. We are returning freedom, authority, and innovation to you, state lawmakers. And I believe the results will be better and more Americans will be insured because of it. Thank you very much.